Trauma is an unfortunate reality for many individuals, but it doesn't have to define us. In this video, we will dive into the topic of trauma and explore the perspectives of 4 experts in the field: Bessel van der Kolk, Peter A. Levine, Gabor Maté, and Dr. Joe Dispenza. These experts offer different methods for overcoming trauma, and we will discuss the key techniques they use in treating it. Whether you're currently experiencing trauma or simply interested in learning more about it, this video is for you. So, if you're ready to understand and conquer trauma, keep watching until the end and don't forget to subscribe and share. Trauma is a part of life for many people. Though most of us know of it, nobody wants to experience it. Yet when it does occur, many of us are unsure of its effects and confused as to what trauma really is. Trauma can have a profound impact on an individual's physical and mental well-being. People can experience feelings of helplessness, shame, and intense fear following a traumatic event. Both simple and complex forms of post-traumatic stress disorders can develop, and it can occur at any age. Common causes of trauma include tragic events, and its symptoms may manifest as anxiety, flashback, and sleep disruption. Each person experiences trauma differently, but its effects can be enduring. Some people who experience a traumatic event may feel physical and emotional changes in their body and mind. This can lead to long-term mental health problems. Psychological trauma is often referred to as the psychological response to a difficult or life-threatening situation. Everyone's reaction to trauma is different. Some may experience its effects right away, while others may be affected by past experiences or make existing problems worse. If you have experienced trauma, it's essential to remember that you can and will survive, as long as you find healing methods or mustering the courage to confront your past. Before discussing how to heal from trauma, it's important to note that there are many types of trauma with various symptoms. Acute trauma. This results from a stressful or dangerous experience in your life. Chronic trauma include cases of rape, child abuse, bullying, or domestic violence. Complex trauma from exposure to multiple traumatic events. Along with emotional reaction, trauma can cause physical symptoms such as headache is pain in any region of the head, may occur on both sides of the head, may appear as a sharp pain, a throbbing sensation, or a dull ache. Digestive symptoms. The most common symptoms of digestive disorders include bleeding, bloating, constipation, diarrhea, heartburn, pain, nausea, vomiting. Accurately diagnosing digestive disorders involves collecting a thorough medical history and conducting a physical examination. Fatigue, extreme tiredness resulting from mental or physical exertion or illness. Racing heart are feelings of having a fast beating, fluttering, or pounding heart. Sweating is the release of liquids from the body's sweat glands. This liquid contains salt. This process is also called perspiration. Feeling jumpy is anxious and jittery, worried, or guilty. If you've ever been so nervous that you couldn't sit still, you know how it feels to be jumpy. Research estimates that between 60–70% of people in North America experience a traumatic event, which can be isolated or repeated. If a person experiences trauma, they may develop either simple or complex PTSD, with symptoms worsening in the weeks or months after the event. Symptoms of PTSD include avoidance behavior, where a person tries to avoid thinking about the traumatic event. To heal from trauma or PTSD, treatment is required. According to experts such as Bessel van der Kolk, Gabor Maté, Dr. Joe Dispenza, Peter A. Levine, there are several ways to heal trauma without the use of medication, using natural methods. Bessel van der Kolk is a physician and psychiatrist who has studied how people cope with traumatic experiences. He is the author of the book The Body Keeps the Score, which explains the science behind trauma and how to work through it with therapeutic techniques. His book is aimed at helping people understand and recover from traumatic events in their past. Trauma is a feeling of fear or danger that comes from experiencing something traumatic. Our brains automatically react to the trauma by trying to figure out if it is safe or dangerous. This creates an intense physical and reaction in our bodies that can be hard to manage. Treating trauma involves helping people to create an internal sense of safety and security in their bodies. Key method of healing trauma, Dr. Bessel and Kolk. Psychotherapy is a way of helping people understand their feelings, thoughts, and behaviors. It can help you learn to better cope with difficult situations, feel more confident, and learn to better understand yourself. It can also help you understand why you may be feeling a certain way and help you find ways to feel better. It's like talking to a really understanding friend who can help you find ways to feel better. EMDR is a type of therapy that helps people work through difficult memories. It stands for eye movement desensitization and reprocessing. In EMDR, you tell a therapist about a memory that makes you feel bad, and then you do some special movements with your eyes. You focus on the memory while your eyes move back and forth, like when you're watching a tennis match. The movements help you look at the memory in a different way, which can help make the bad feeling go away. It's like you're rewiring your brain to look at the memory in a different way. EMDR can be really helpful for people who have been through a traumatic experience. Yoga is a way for you to connect with your body and your mind. It helps you to feel more aware and present in the moment and to appreciate the beauty of your body. When you practice yoga, you'll learn to move with a sense of awareness and control, while also learning to relax and breathe deeply. You also learn to be more mindful and to appreciate the present moment. Playing different roles through theater and movement can help you to explore different aspects of yourself and how your body can feel. By engaging in role play, you can access different feelings and perspectives. For example, how it feels to be a king or a warrior. This can help you to gain a deeper understanding of yourself and your body. Neural feedback is a way to help your brain become more open to new experiences. It encourages you to think differently and make changes to your thought patterns and behaviors in order to better cope with potential new situations. By regularly reflecting on your reactions to certain situations and actively working on changing them where necessary, you can shape your brain to be more receptive to new experiences. Psychedelics are a type of drug that can help people to experience a different reality or open their minds to a different perspective. When taking psychedelics, people may find themselves in a different state of consciousness. They may see themselves, as well as others, in a new light, often finding compassion and understanding. This might help them to look at past experiences and events differently, leading to improved self-awareness and self-perception. Taking psychedelics with two therapists in the room can help to ensure a safe experience. For real change to take place, the body needs to learn that the danger has passed and to live in the reality of the present. Food of Dr. Bessel and Kolk. Dr. Gabor Maté is a renowned expert on trauma and has developed a unique set of methods to treat it. His approach combines physical and psychological techniques to help individuals heal. These methods include connecting with the body, self-regulation, trauma release exercises, acknowledging and expressing emotions, and rewiring the nervous system. His approach emphasizes the importance of understanding the physical, mental, and emotional effects of trauma and how they can be addressed. Through his methods, Dr. Gabor Maté helps individuals to heal from trauma and move forward in life with greater emotional resilience. Key method of healing trauma. Dr. Gabor Maté. Connecting with the body. Dr. Gabor Maté believes that connecting with the body is essential for healing from trauma. This can involve mindful movement, yoga, dance, physical therapy, or other body-based therapies. Self-regulation. Self-regulation is the ability to regulate one's emotions, thoughts, and behavior in order to stay balanced. Dr. Gabor Maté recommends mindfulness-based practices such as meditation and breathwork as tools for self-regulation. Trauma release exercises. TRE is a set of simple exercises designed to release tension and trauma from the body. Dr. Gabor Maté believes that TRE can be a powerful tool for healing from trauma. Acknowledging and expressing emotions. Dr. Gabor Maté encourages people to acknowledge and express their emotions in a safe and healthy way. This can involve talking to a therapist or journaling. Rewiring the nervous system. Dr. Gabor Maté believes that the nervous system can be rewired through conscious, intentional practices such as mindfulness, breathwork, and TRE. He believes this can be an important part of healing from trauma. Whenever there is tension, it needs attention. Dr. Gabor Maté. Dr. Joe Dispenza is a world-renowned educator, lecturer, researcher, and New York Times best-selling author who is dedicated to helping people heal trauma and make lasting change in their lives. He is a pioneer in the field of neuroscience, which explores the connection between the mind and body and how the brain can be rewired to create positive outcomes. Dr. Dispenza's groundbreaking work has been featured in major publications and television programs around the world, including The Dr. Oz Show and Super Soul Sunday. He has dedicated his life to helping people discover their true potential and live life to the fullest. Through his comprehensive teachings, Dr. Dispenza provides people with the tools and knowledge they need to break free from the limiting beliefs and behaviors that keep them from living their best life. Key method of healing trauma, Dr. Joe Dispenza. Mindfulness helps people to become aware of their thoughts and feelings, and you can learn to be more present in their lives. It can also be used to cultivate a sense of acceptance and self-compassion. Neuro-linguistic programming, or NLP, it's a type of therapy that helps to reprogram the brain to respond differently to trauma triggers. It can also help to build emotional resilience and improve self-esteem. Acceptance and commitment therapy, or ACT. It helps people to accept their emotions and thoughts without judgment. And the benefits of ACT: it acknowledges negative experiences are a part of life. Acceptance, cognitive diffusion, presence, self-observation, values, and committed action. There are 6 principles of ACT. Cognitive behavioral therapy, or CBT, it helps people to identify and change unhelpful thinking and behavioral patterns. And it helps you to become aware, and the benefit of cognitive art: it gives people hope about their condition. It helps people develop self-esteem. It can help people relax. Psychodynamic therapy focuses on understanding the underlying causes of a person's emotional and distress. And the common goals and benefits are decrease in symptoms of anxiety and depression, improvement in self-esteem, better ability to pursue long-term goals, love your future more than your past. Dr. Joe Dispenza. Peter A. Levine is an internationally recognized pioneer in the field of trauma healing and recovery. He is the creator of the somatic experiencing method, which is an evidence-based approach to healing trauma and has been used to help millions of people worldwide. Dr. Levine's Keys to Healing Trauma is a comprehensive guide to understanding and responding to trauma. It provides an overview of the science of trauma and the psychological and physiological effects it can have on a person. It also provides practical tools and techniques to help people work through and heal from traumatic events. This book is an invaluable resource for both those seeking to understand their own trauma and those working to help others heal from trauma. Key method of healing trauma, Peter A. Levine. Establish safety. Safety is essential for healing trauma. It is important to create a sense of safety through physical space, relationships, and the therapeutic process. Acknowledge the trauma. It is important to recognize the trauma, not try to deny it or push it away. Allow expression of feelings. It is important to be able to express and experience the emotions associated with the trauma, such as anger, fear, or sadness. Increase resources. It is important to build up internal and external resources to help manage the trauma. Shift perspectives. It is important to gain new perspectives on the trauma, such as understanding it as part of life or finding meaning in it. Connect to the body. It is important to connect to the body and its sensations in order to heal the trauma. Practice self-regulation. It is important to learn to self-regulate and cope with emotions and sensations that arise. Dissociate from the trauma. It is important to be able to dissociate from the trauma and move on with life. Somatic experiencing helps individual become aware of physiological sensation with the trauma and to learn to self-regulate. It can help to reduce the symptoms of PTSD, depression, anxiety, and physical pain, and help to improve relationship and communication. Trauma is not what happens to us, but what we hold inside in the absence of an empathetic witness. Peter A. Levine. What do you think is the best way to treat of trauma, according of our 4 experts of healing trauma and their way of how to overcome trauma? We know that the most of people have a different ways of handling their own problems in the past, but we have our own decision on how to properly overcome our own trauma. If you think it's good to have a guide on how to heal ourselves trauma by them, Bessel van der Kolk, Peter A. Levine, Gabor Maté, Dr. Joe Dispenza, they are the expert of trauma and they have a different books about trauma. Is how can we find a treatment that allows the basic sense of defectiveness and self-loathing to be controlled? According to them, different people need very different things. Everything is an experiment in life, and healing trauma is an experiment. Thank you for watching our video. I hope it helped you, and if you liked our video, just follow us and don't forget to click the bell icon and share to be updated to our next video.